Hello, I'm Dr. Vivek Nangia, Chief of Pulmonology, Cluster 1 Max Healthcare, India. I am also the Principal Director and Head of the Institute of Respiratory, Critical Care and Sleep Medicine based out of Max Hospital, Saket. Bronchial asthma is a heterogeneous disease characterized by inflammation of the airways. In patients with bronchial asthma, there is narrowing of this lumen through which the air has to go. This narrowing could be because of inflammation, because of mucus being produced, because of spasm of the muscles, which results in narrowing of the airways further. So there are multiple reasons why the airways get narrowed in these patients. The most common risk factors for developing asthma are smoking, allergies, occupational exposure to some noxious substances and gases which can result in inflammation in our airways. The most common triggers which could precipitate bronchial asthma include animal danders from furry pets inside the houses like dogs, cats. It could be pollens in the air outside, emotional stresses, anxiety, even laughter could actually precipitate an asthma episode. The diagnosis of asthma is based on a detailed history, a physical examination, and some very basic tests. Detailed history should basically include history for any allergies that they may have, family history of asthma, history of variability in their symptoms. When I say variability, I mean that the symptoms could be there during the daytime and may not be there in the evenings and then again appear at night. There could be variations in symptom depending on the activity, like physical stress or emotional stress. They could all determine the variability in a patient. Exercise-induced asthma basically is when a patient develops asthmatic symptoms during exercise. This usually starts from 10 to 15 minutes after starting the exercise and could go on till even up till 4 to 6 hours after the strenuous physical activity is over. It is usually due to the exposure to cold air. What actually happens is that when somebody is exercising, they're usually breathing through the mouth. When they breathe through the mouth, it's the unfiltered air which is going inside. Cold air, unfiltered, that results in an inflammatory cascade getting triggered off in the airways and resulting in bronchospasm, bronchoconstriction, and asthma-like features. The treatment of it would be to use a reliever inhaler 10 to 15 minutes prior to the scheduled exercise. The treatment of bronchial asthma will basically comprise of controlling the triggering factors. If the triggering factors are controlled, then obviously the asthma will also come under control easily. The specific treatment of bronchial asthma entails use of two types of therapies, the rescue therapy and the maintenance therapy. Rescue therapy basically means use of certain medication which is on an SOS basis, and maintenance therapy because asthma is also like a chronic disease, like you have diabetes, hypertension, heart disease. This is also a chronic disease for which you need to be regularly on therapy on a long-term basis. Inhalers, or actually if I put it another way, taking medication in the inhaled form is considered to be the best medication for treatment of bronchial asthma. Why do I say that? Because when we're using inhalers, we're using dosages of the medication in micrograms, which is 1/1,000,000th the dose that we would have to give you in the form of tablets. It is reaching the site where it is supposed to act, because when you're taking it in the inhaled form, it is going directly into the lungs and is actually acting in the lungs itself. The disease is primarily in the lungs. It has minimum side effects because it is not going through the bloodstream, first getting into the bloodstream, then reaching the lungs. So it has minimal possible side effects. So low dose, direct action at the site where it is supposed to act, and minimal side effects give us the advantage of using inhaled therapies. Now, inhaled therapies could be in the form of dry powder inhalers, MDIs or the multi-dose inhalers, or could be in the form of nebulizations. But the maintenance therapy should be continued on a long-term basis. People with bronchial asthma should also be taking their vaccinations, especially the flu vaccine, in addition to the COVID vaccine, on a periodical basis. A common test used for the diagnosis of bronchial asthma is called a pulmonary function test, or a PFT. In this test, you actually have to blow and the machine actually captures the functional capacity of your lungs. Some of the patients, despite being on regular therapy, don't come under control. They're labeled as difficult to control asthma patients. In such patients, what is important is first to confirm the diagnosis, two, check the adherence of the patients, whether they are adhering to your therapies or not, three, whether they're using their inhalers properly or not, if they have any underlying comorbidities or not, and if despite all this, patients continue to have symptoms, then we categorize them as severe asthma patients. When you have patients with severe asthma, what do? We do their phenotyping. We check their eosinophil levels, we check their IgE levels, we check their FeNO, we even sometimes do their sputum for eosinophil levels. So we do all of that and then conclude whether they are in the allergic variety or the non-allergic variety. Different individuals could be allergic to different kinds of foods, but the common ones that people are usually allergic to include milk, eggs, seafood, tree nuts, peanuts, wheat. Bronchial asthma can be easily prevented. It can be prevented by avoiding exposure to dust, smoke, fumes, by allowing furry pets, cats, dogs inside the houses, using more of vinyl flooring, more of wet mopping than brooming inside the houses, avoiding strong smells, strong perfumes. At night, when the patients are sleeping, the fan should not be full speed on. The ambient room temperature should be around 24 degrees or 25 degrees. Patients should avoid having anything chilled, cold, frozen, and live a healthy lifestyle.